Hi, I'm Tamara, and this is TELUS Talks with Tamara Taggart. Hi, everyone. Today I'm speaking with Dr. Joy Masuhara, who is a family physician who has specialized in the care of the elderly throughout her career. She's an advocate for change, with her interest in improving lives extending to community and volunteer work. Hello, Dr. Masuhara. How are you?
Great. Great to
Good.
be here.
Now, is it okay if I call you Joy or?
Yes, absolutely. I,
Okay.
I get called all sorts of things, so
I'll
it's
go with
fine.
Joy. So it's funny how I found you. I was on a Zoom call and it was a like Disability Politics 101. It wasn't very long ago. It was maybe a month or so ago. And as I was listening to the Zoom call, I scrolled through all the squares to see who was on and I saw you there and I was like, "Oh, who is Dr. Joy Matsuhara?" And I Googled you and wow, I just thought I have to talk to this person because you have an incredible life and your work is really, I just think everybody should understand what it is you do with your career. So there's a lot of things you do, but what keeps you busiest in your day?
Well, it varies. It depends on the day. So yeah, like you said, I'm a family physician. I work in older adult mental health, and that work I do part time now because I'm slowly moving my way into less physician work. Um, so that definitely keeps me busy. The last few years, I've also been sort of putting time into leadership committee work within the healthcare field. So, and in particular, working on diversity, equity, inclusion issues. So we've finally, well, we're needing to really improve how we do a lot of things in healthcare. We know that from all sorts of reports and inquiries and everything that's come through over the last little while. So it's really great to see our healthcare organizations moving that way, and that's been a big huge interest area for me for a long time.
So for people that, aren't familiar with I mean, really, you and you met your partner I did a little research here. You met your partner in the 90s. And the two of you were, along with some other couples, you challenged the BC marriage laws for discriminating against same-sex couples. And then you and Jane were married in 2003.
That's correct. That's my former partner.
Okay, sorry, I'm not up to date.
Yeah, no, that's fine. That's fine. And yes, and that's correct. We did do that, and that was really landmark case. Canada was the third country in the world to legalize same-sex marriage. So it was yeah.
Yeah, well, I mean, I want to ask you about that because it wasn't that long ago. I mean,
No, it wasn't.
2003 was not that long ago. And when I was reading about you and reading about that experience and that, as you say, landmark moment, I mean, it changed everything in this country, really. What was that like for you? Like, was it scary? Was it, um, because you're putting yourself out there. You're,
Yeah, yeah, you probably
that's,
know this too as a public personality. Yeah, we knew, we were told by our legal team that this it would probably take 7 years from start to finish, and it would go all the way to the Supreme Court of Canada. It took about 3 years in total to get it through federally. Well, 2005 was when it changed across the country, but by 2003, people were actually getting married because it changed in Ontario and BC. So yeah, it was a little bit scary, but at the same time, we had a great team. We worked together with all the other couples. There was great bonds between us and our lawyers, who were probably the top constitutional lawyers in the country, and they were the whole team. backing us was really wonderful. I mean, there were a few of the couples did get, not very nice mail, and but I didn't experience anything, really personally that was really
Right.
where I really felt in danger. But it is, it's high exposure, for a short, intense period where there's a lot of media attention, and I think because I was a person of color, they wanted to interview Jane and I often, so that sort of puts you out there, and I'm sure you know how that feels as well. But
Yeah, but I mean, you are a person of color. You are
mhm.
in the medical field. Um, you're a woman. You've done these things that I would think like. What kind of discrimination or racism have you faced in your advocacy for same-sex marriage and in the medical field? Really?
Yeah, I guess a lot of cultural communities, particularly some of the Asian communities, uh, have difficulty with um, you know, uh, gay and lesbians, trans individuals. So the whole queer, diaspora, I guess, that, there's not always really good acceptance. And, I think also, just from my own background being, from being Japanese, Japanese Canadian, there's, there's the huge, not wanting to stick out still. This is the sort of trauma left over from the World War II and the internment of Japanese Canadians. So you really want to sort of lay low,
You didn't do that.
No, so I think it is a challenge, and I think it's certainly a challenge for all. I think a lot of multicultural communities have a harder time with the GLBT community, the queer community. So we need to, we need to be out there and make it not so scary for everybody.
Yeah, and I think that's why it's, that's why I wanted to bring up your challenge to the BC, marriage laws, because it was, I remember the time that it was happening, and thinking, wow, like, why can't everybody just get married? And it was a huge moment in this province and in this country.
Yeah,
So, I mean, I'm always in awe of people that will put themselves out there and stand up for what they believe in. So I couldn't not talk to you and not ask you about that, because it was it's just such an important time, and I think it speaks to your tenacity in the work that you do with older adults. And so I noticed that you say older adults. You don't say seniors. You don't say elders. You don't say why do you say older adults?
um, well, that's what the program is called, I guess.
Wait, you didn't come up with this, Joy? What?
It wasn't my idea, but some people don't like the word senior. If we could call everyone elders, I think I like the term elders. It gives a bit, that note of wisdom to elders, and then but in practically, older adults just differentiates it from adults as well in our programming in mental health, in community mental health. So, but older adults just as it's they're older,
And they're adults.
and they're adults. Yes. and, and they
So
have challenges sometimes. And
yes. And I would think that it's been very difficult work the last couple of years with the pandemic and what we've seen happening in long-term care homes.
yeah.
So your work involves house visits or home visits. Tell me what it's like for older adults. What is it like for older adults in long-term care homes, in hospital situations, or in their homes and on their own? What's this time like?
Oh, I think it's been very challenging for many. The in hospital and in long-term care, of course, the inability to see family, I think, had a huge impact on many of the older adults. The residents of those. Or if you're just in the hospital, who do you want to be with if you're in the hospital? You want to be with, your loved ones, and that just wasn't possible most of the time. I mean, I think the system tried to accommodate. There was a lot of video calls, but it's just not the same as the in-person contact. And then even in person, you're still wearing masks. And I remember when I was first going in, we were full PPE, so we masks and gowns and gloves, and then if you're someone with a dementia, sometimes you don't recognize the person. So yeah, that's challenging, and then also for the caregivers, very challenging.
Yeah, I
In
think
the
I
in
sorry,
Yeah.
Joy. In watching what was happening across the country in long-term care homes, and I mean, so many people died. So many people died. And I heard numerous things like, oh, these people were already old and they were going to die. And almost like it's like you can't understand something until you've actually walked in those shoes. So yeah, we are all, if we're lucky, going to be older one day, right? And we will be there one day. And I just to have the last, years of your life and not see your family, not see your friends, be completely isolated. It would absolutely destroy not only that person's mental health, but the mental health of their families too, not being able to spend that quality time.
Yeah, absolutely. Yeah, and certainly we would see the long-term care facilities. I was very lucky to be working in ones that didn't have really bad outbreaks, um, and the staff just did the best they could. I think we're really seeing some of the structural and systemic systems problems that were sort of amplified with COVID, because many people have been saying for a long time, we need more resources in long-term care. Um, so yes, all those things, the isolation, all of that, very challenging for caregivers and families, and of course the residents themselves. Some, if you're lucky and your dementia is a type, because most of the people living in long-term care now have a dementia. If your dementia is a type that you're just living in the moment, then if your moment is pretty okay, then it's pretty okay. Um, but if you have any awareness of what's going on around you, then and you're noticing that people are missing from your life, people that you normally would see, yeah, that could be very challenging, or you feel abandoned, etc. So I think it's had a major impact, and it's so great now that family are able to visit with no restrictions at
Hmm.
this point.
So when you reflect on the last 19 months or however long it's been, I have no sense of time anymore. Um, is this sustainable for older adults living in care or living at home on their own? Is this like what's it going to be like when it's time for me to maybe go into a long-term care home? What like is the way we're doing things now sustainable?
That's a tough question. Are they I think everything is sustainable. It's just a matter of how, what the quality of that is going to be. Um, without any sort of increase in some resources. We do things differently. Yes, of course, we can always do things differently, and there are models around the world that may be more sustainable, maybe better quality. So I think we have to learn from wherever we can. Um, but I think we do need to really look at where the gaps are, and how we can fix some of them. um, and not necessarily with huge amounts of, well, of course, you always need money, but how can we look at how we can do things a little bit differently? So we're looking at the quality for the money that we're putting into the system. There's lots of different ways to approach all those issues.
I'm thinking about, when I was a young girl, I used to be a candy striper. I'm aging myself now. Okay. So, and it was at Burnaby General Hospital, and I was 12. And I can't imagine they would let a 12-year-old go into the hospital now. And, but I loved it. I did it. I did it a few hours every week. I was dropped off. I put on my striped uniform and I went up to the floor, the extended care. And I would spend, hours either feeding somebody, sitting and watching TV with them, playing cards, reading a book, sometimes just sitting and holding a hand. And what I noticed at that young age was how lonely it was for the people there. And this was pre-pandemic, pre-everything. And it almost felt to me like, when after you reach a certain age, it doesn't matter anymore, and so we put you away almost. And there was no family coming and visiting. There was no, and I wonder how much it's changed since, that was the early 80s. Like, how much has it changed? Are we better?
I think most long-term care facilities will have social programs. They'll have programming. These are things that are really, really important, and we should be spending, more dollars to have activities. A lot of people need one-to-one, like you were doing, Candy Stripers were doing, just to sit down and meet with that person. Because some people they don't want to catch the balloon ball or or do some of the other group activities. Some do, and that's wonderful. But just that one-to-one contact can be really, really important. So that's really hard to manage with the staffing limitations that we have. But most facilities will have a recreation program, which I think is part of an essential part of the whole there. It's a really, really important part.
Right. So when the the program that you work with, the Community Older Adult Mental Health and Substance Use Program, are there a lot of seniors using substances?
Less than the younger folks, but there's enough for us to have counselors and others to handle those patients,
right,
who may have those difficulties as well.
Right. And I read sometimes about, so I guess there's the whole debate between, private long-term care homes and, government run, and the whole thing. And I'm not sure what the right answer is. Obviously, I'm not an expert with any of that. But I have done some reading where I've seen that, a lot of older adults are given drugs in these care facilities, if you will, to, I don't know, calm them down or help them sleep, or like in your work, do you see that? Do you see like an overuse of maybe, drugs to...
Yeah, there's been quite a push to decrease use of medications for behavior management. I mean, with dementia, there are certainly sort of what we call behavioral and psychological symptoms that can be very distressing for the individual, but also can be risky to others around them. So depending on the risk of those things, of course, the first sort of mode of treatment is non-medication. So again, and again, that works better if you have the staff that can do that can spend the time. So that's another reason, to do really good sort of non-medication management of behaviors. And even just, it takes longer to maybe, help a person get dressed or toileted, etc. If they're responding in a way because they can't figure out their environment, and so they're afraid. So sometimes it just takes longer to do those tasks than, we need the staff to be able to have the time to do those things, to keep people safe and healthy, etc. So, have medications been used in the past to manage behavior? Yes, of course. And are they still being used sometimes? Sometimes they are necessary, but there is certainly more and more. We are really working hard at limiting the use of those medications, and taking them away. Often, if a person goes into hospital, they have what's called a delirium, so it's sort of a medical emergency. These medications are often used in hospital, and then sort of kept on, as the person transitions. Transitional time, into a facility can be really challenging. So, sometimes those medications stay for a bit, and but we're really, really working hard at trying to limit the use of those, and that's all been in the medical literature, the guidelines. All of that is now pointing towards using less medication. Does that mean we're using no medication? Sometimes medication is the right thing to be doing for some who have really challenging, distressing, very, very risky symptoms, psychological or psychiatric symptoms. So,
are you seeing, how often do you see depression in older adults?
It's quite common, very common. We know that older adults do have a higher rate of depression, and that's where you may see the substance use as well. We mentioned, I mentioned before that we probably see a little bit less, but older, we have to always think that there may be some substance use issues. So alcohol being probably the more common substance used. So sorry.
No, yeah, no. And I guess I asked that about depression or anxiety.
Yeah. Really common.
Very common. And what about access for older adults? Access to therapy, access to, I mean, it's difficult for everybody right now to reach a psychologist or a psychiatrist or a therapist of some sort that to help. Yeah, I would think it's very difficult for an older adult.
Yes, it is. And depending on your, what culture you come from, I work primarily with older adults from the multicultural community, so primarily the Chinese community, because of the neighborhood I work in and the nurse that I work with. So in some communities, of course, there's a huge stigma around mental health. So reaching out, when you're experiencing depression, anxiety, a lot of people still don't know, really what depression is, and so a lot of people will, or even when they go, they may talk to their family doctor, and their family doctor may suggest a mental health professional, but they often will decline. So So there's stigma, in our general society, but there are a lot in some of the Asian communities that I've been working with.
And what about poverty? Um, uh, do you see a lot of poverty with our older adults?
Yep. Yes, I think women in particular are ones that are very vulnerable to economic disparity. So you get into a place where you're on a very fixed income, and everything around you increases in price, particularly housing. Housing is a huge, housing is a big issue in Vancouver, of course. So senior, they were using the
I
word
know, I know,
seniors.
I know. It's hard to not use that word. We're so used to using that word. But I agree. I do like older adult much better.
Yeah, but
Um,
I think women in particular are more vulnerable that way
mhm.
as they age.
Okay. So I want to ask you a bit more about that in a second, but first I wanted to share that we like to thank our guests for spending some time with us, and we ask our guests to choose a registered Canadian nonprofit organization to give $500 to. You chose Atira Women's Resource Society, which is a not-for-profit organization committed to the work of ending violence against women. So thank you for choosing Atira. Very familiar with their work, and we will be giving them $500 in your
Yes, thank
name.
you.
So thank you. So when we think about, I mean, now I feel really, I think we all know this, right? With our older adults, there is depression and anxiety. We're in a pandemic. People are lonely. There is poverty. There's been a huge shift in so much. What are the steps to improving the lives of our older adults, not only now, but also in the future? Because we are always going to have older adults in our communities.
Yeah, there are, that's another tough question, Tamara.
I'm sorry, but you're the expert.
How are we supposed to change the world? Um, Well, I think we can look at it from all sorts of perspectives. One is just, how do we build community? How do we really focus on, social inclusion? We know, from, the sort of in urban planning, et cetera, when we look at resiliency, when there's higher social inclusion, so where communities really know each other, neighbors know each other, when there's been disasters, that's when those vulnerable in the community are actually less at risk. So, if you live in an apartment building and you have a neighbor upstairs that's going to have difficulty, vacating, in a emergency situation, etc. Or, we had the heat dome this summer. If we know where our vulnerable adults are, because we're a closer community, that can save lives. So those are some things. Our being able to work together, all of our nonprofit organizations, working together, making sure that whatever work you're doing, that you put an intersectional lens on it, so that older adults aren't missed, with whatever work you're doing, that the communities that are at higher risk, and we know what they all are with our COVID experience worldwide. We know the queer community has, women, older women, youth, multicultural immigrants and refugees. These are all the people who are at higher disadvantage, say, and we don't want to make it the oppression Olympics or anything, but uh, we know who has more barriers to to cross. So, in our multicultural older adults, having places where they get culturally appropriate care, our Indigenous communities, we really need to pay attention to safety in even the accessibility and safety. So there's all these things that we can do right now in our system as it is to improve things, not just for older adults, but for everyone.
Mm-hmm. I noticed that in the disability community. And one of the things I've noticed in the pandemic is it's almost like nobody in government or in they can't say the word disabled for some reason, right? It's always the vulnerable, it's always the seniors, it's always but 25% of us are disabled. And I really feel like it's that's part of the hurdle. I feel like if we just acknowledge that disability is a part of life,
yeah,
and many of us move in and out of disability. You may have cancer, and you are disabled when you have cancer, and then you move out of that. But some people stay there forever, and I think that when we hear about older adults, many of them are disabled, and we still can't even say it then.
Yeah, it's true. It's true. And then, and even within the community, people have different opinions about how they want to be named.
Yes. I know. It's not an easy fix.
No, it's not an easy fix, but we can always ask, right? We can always ask how you want to be introduced, how you want to how you see yourself, and the workshop that you mentioned, I thought was very, very well done. The disability politics workshop. Where you saw
where I saw you, and then I creeped you on the internet so I could interview you, because it's really nice, Joy, to have a conversation about this, because it's something I find that we don't talk about enough. We don't talk about, we hear about older adults, we hear about the long-term care homes. We hear about depression or substance abuse, mental health challenges within that, demographic, but we don't talk about it enough. And I don't know, it just feels like we're all so busy sometimes that we forget to ask our neighbor, are you okay? Like you said, with the apartment building, right? Like, how's that person going to be today? Can they get their groceries? Community care, right?
Yeah. Yeah. And, and knowing what some of the supports are out there, there's lots of, supports and lots of great organizations that are doing all sorts of, wonderful work to help support those that need a little bit of extra help, in the community. So, having, we don't have a perfect way of getting all those supports known to everyone that really needs them, but that's why shows like yours are helpful.
Well, it's a good reminder talking to you to recognize that this, caring about our older community members is important, because we will all be older community members at some point.
Yeah.
And I would hope that somebody would look out for me when, if I'm in a long-term care home and, we're in the middle of a pandemic. It's more than just a news story. They're real lives. And I'm sure you've seen it all. So if someone's listening and, they've never really thought about, older adults and the care that they need, what's one thing they could do? Or do you have a suggestion what they could do to maybe learn more, or where would you point them to learn more about what's happening with our older adults?
Oh, that's a big topic.
I know. I'm sorry. Is there a website? Come on, Joy. Is there you're not on social media, so I can't follow you.
Yeah, exactly. Learn about everything about older adults in one place.
In one
Um,
website.
and well, the thing is, we're all, I can consider myself moving into older adulthood as well. So we're all different, right? So there isn't going to be one place that's going to tell you everything. Um, we're all individuals. Just start talking to people. There are some amazing stories. That's the one thing I love about my work in, basically area, older adult care is learning about people's lives, um, what they can remember of them. Sometimes that's a little sketchy, but most of the times their remembrances are pretty amazing. So um, and everyone, yeah, like I said, everyone's an individual. So just sort of see them where they're at. Uh, just you
Yeah.
see someone waiting for a bus, say hello.
Yeah. Yeah, it's true. And the storytelling. Joy, thank you so much. It's been a pleasure to talk to you, and I'm so happy that I stalked you on the internet, and I was able to track you down and have a conversation with you. So I really appreciate your time. Thank you so much.
You're very welcome. Great to talk to you.
Thanks for listening to another episode of TELUS Talks with Tamara Taggart. Be sure to subscribe so you can join us every Tuesday for another conversation. You can also check out our website, telus.com/podcast, and subscribe to our YouTube channel at TELUS Talks.